So, by way of introduction, my name is Paul Winterton. I'm a board-certified orthopedic surgeon and an enthusiast of the clinical application of essential oils as well as use in the home. And this topic of safety of essential oils is one of my favorite topics because it moves from the home into the science and, of course, into the clinic where I spend a lot of time working with patients with essential oils. You know, we owe a lot to the French tradition. My colleagues in France are the ones that have really spent a lot of time clarifying and elucidating the issues of safety, particularly hypersensitivity about essential oils. When it comes to the use of essential oils worldwide, we know there have been about 400 main essential oils elucidated throughout the history of essential oil use, and 100 of those 400 essential oils are used in a clinical setting. When it comes to testing essential oils, we know that a lot of the perfume and flavor industry spends a lot of time assessing the safety of essential oils, and that's really what we wanted to talk about. We're talking about local topical application of essential oils and some of the effects that can have there with hypersensitivity and systemic effects in our extremities, and particularly when we're talking about our organs. When we use essential oils topically, we need to make sure that we use them in a very nice diluted manner. That is, instead of just putting pure essential oils on the undersurface of our little 7-month-old foot, we want to make sure that they're well diluted. And how I usually do that in my home or with my patients in the clinic, I usually put a little palmful of just plain scented, non-scented lotion, or what I use is pharmaceutical grade lipoderm. And then I put 3 to 4 drops of whatever essential oil I'm using. And that particular dilution, which tends to be about 5%, is really consistent with what our colleagues in the United Kingdom, how they've been using essential oils in a clinical setting and at home for decades. And as it turns out, not only are the French using them topically, but also they move more into the oral use. And I think as a mother at home or a father, when you're working with your children, you need to know that it's very safe to use essential oils topically, and we're going to go through some of the issues. When it comes to hypersensitivity, we're talking not only the superficial skin, the integument is what we call it in clinic, or the dermis, or the epidermis, but also other parts of the body. And when we talk about hypersensitivity, we talk about the effects of essential oils on our kidneys, or what we call nephrotoxicity, to our liver, what we call hepatotoxicity, and there can be effects on our neurologic system if there are overdoses. And I think that's probably an important point to talk about. When it comes to use of essential oils in the home, you're going to be very careful to keep essential oils in a safe place. They usually come in 5 cc or 1 teaspoon bottles or 15 cc bottles. You want to keep them in a dark place so the chemicals, or what we call the constituents of the chemicals in that essential oil, don't break down, and that they'll have a lot more shelf life. But also keeping them in a safe place so you don't have a child that gets a hold of them. Among the millions of patients or people that have had exposure to essential oils, compared to currently in the United States, we have FDA-approved medications that are used daily, but in just one day, today, there have been 10,000 untoward side effects based on that. Not a bad track record when we talk about non-FDA-approved essential oils and how we have a virtual safe record, which is great for me, not only as a father of 4 children, but also as a clinician who uses essential oils daily with thousands of patients that I've used them with. And I'm going to talk later about the use of essential oils in the clinical setting. I won't go into the biochemistry, but the toxicity or the hypersensitivity associated with essential oils are based on those essential oils that have a lot of what we call aldehydes, and that's pretty much the chemistry. We're concerned about prolonged exposure as well. Most essential oils are placed on the skin for a very brief amount of time during a massage, and often if there is a hypersensitivity to essential oils, we can usually count on treating those with some nice warm water and some vegetable oil to dilute whatever might be causing a hypersensitivity. Sometimes there can be a hypersensitivity where the people actually feel the chemical effects of that essential oils, and it's always related to an undiluted exposure. One good idea as a parent when we're dealing with wanting to know whether a particular oil might yield some hypersensitivity on our child's skin would be to take a little diluted amount, get a little Band-Aid, put a little amount on that Band-Aid, and just put that Band-Aid on the undersurface of the forearm or on the back or on the belly, and that can really be a great test. We call that the patch test. So with patients that might have some hypersensitivity to smells, you can get a specimen, put it under their nose. Some of my patients really might love floral scents, others might not. I think as long as you're very careful with your family members or your patients to just make sure that there's a serious dilution and to keep the specimens in a safe place. And that's probably an important cue to talk about the volume. When we talk about lethal doses, when we use oral essential oils, it's usually a diluted no more than 1 or 2 drops. Those who have significant response to oral toxicity are taking thousands of drops, teaspoons full. And so that's where we talk about hypersensitivity. It's really a non-issue. With regard to purity of essential oils, I think as a clinician, I expose my surgical patients to a lot of non-surgical and surgical trauma, emotional trauma, discussing surgery, post-surgical management. It's so important to me to know that the essential oils I use have been sourced in a way where they are 100% pure. And when I use doTERRA oils in a clinical setting, I know where they've been sourced, where they're pronounced pure with no adulterations or no additives. And it's often the additives in perfumes, in flavors that are greatest concern regarding developing hypersensitivity. One important thing to understand about sensitivity is the amount of time that can be exposed, and it should be emphasized that if you start noticing a hypersensitivity or a response when topically applied, that can develop over a day. Most of the time, if there is a hypersensitivity that's going to form, it can be formed over a week or a month or sometimes even years of exposure. One other interesting topic that we should mention is the synergy of essential oils, that an essential oil has constituents in it, then when they act alone have a certain effect regarding supporting one's immunologic status or gastrointestinal status. But sometimes certain constituents combined together can actually heighten the effects. And so we should be aware of synergy of essential oils when we talk about safety. One important topic that should be discussed is photosensitivity. There is a chemical constituent called furanocoumarin. And those particular types of chemicals that are usually and exclusively in citrus-based oils are the ones that are most commonly associated with photosensitivity. And so when using those particular oils, it should be emphasized to avoid a lot of sunlight or any sunlight exposure following use of those oils. Chemical sensitivity is rare, but often you'll see when using highly concentrated, typically obvious essential oils such as clove or oregano or the third oil that most people have a real hypersensitivity to is cinnamon. Those three oils should be used with much care, particularly with regard to vulnerability of extreme hypersensitivity. So let's go on to the second part of our discussion and talk about drug interactions. Some of essential oils do have an interaction with certain FDA-approved medications. And I think it's healthy to know what particular essential oils can have a particular drug interaction. Let's just move briefly. I don't want to get involved with too much of the science, but in the liver, there are enzymes called cytochrome P450 enzymes. And those enzymes are the chemistry that helps us metabolize medicines that we take. And so if you have a medicine that's fat-based, a cytochrome P450 in the liver helps those medicines become water-soluble, and then you can pass them out in your urine. Well, some essential oils can affect cytochrome P450s and can inhibit their effects and therefore cause certain FDA-approved medications to stay around in your system a little bit longer. So it's worthwhile being aware of that principle. With regard to platelets and antithrombotic effects of essential oils, there are some essential oils that can decrease the ability of platelets to coagulate. Also, there are some essential oils that can affect blood sugar levels, and for those patients who are diabetic, either type 1 or type 2 diabetes, there are a certain specific family of essential oils that can cause a transient bump in glucose levels, particularly with response to dermal and gastric absorption. There are essential oils that you can apply that will improve the absorptive capacity of essential oils and also can improve the gastric absorptive capacity of certain medications that you take, and it's worthwhile to know about those. One of my favorite topics with regard to essential oils is clinical application, and for about 5 years I've progressively integrated what I'm calling complementary care with my patients. One of the main, I would say the number one complaint that people have with traditional health care, walking into a clinic, is anonymity. They complain about being treated like a number, and they feel anonymous, and they don't feel attended to by their physician. And with application of essential oils, particularly with regard to massage and using them perioperatively, it's a wonderful way for me to help my patients through palliative, what I call comfort care modalities. Orthopedic offices can be very anxiety-provoking, and often associated with feelings of anxiety come bumps in heart rate and, of course, blood pressure. And given those difficult issues that patients deal with in my office, providing some type of way to alleviate those stressful feelings that can be soothing, and of course all the side effects of improving one's feelings of anxiety with the soothing effects of a hand and foot massage that I provide in my office have been wonderful. Perioperatively, the surgeon and the patient are very interested in a healthy healing response, and essential oils can be very supportive of our immune system, and that in turn is very helpful as we go through the process of recovery. Another interesting phenomenon is this motion hypersensitivity that some patients have around the time of surgery, and that effect can be significantly soothed by use of essential oils, and those particularly soothing essential oils that I use for this problem are cardamom, spearmint, peppermint, and ginger. As a matter of fact, the University of North Carolina has studied those particular essential oils and has really had some excellent data that shows how supportive those essential oils can be towards helping people with those symptoms. Some of my patients around the time of surgery can really benefit from the warming and cooling effects of some essential oils and how soothing that can be. And I would recommend for those particular patients Deep Blue blend that many of my patients use, as well as wintergreen essential oils, of course, in a diluted fashion. So now that I've fully covered how I've applied essential oils in clinic to help my patients, use them in the preoperative setting, in the postoperative setting, and post-surgical setting, getting back full circle now to use of them in the home. If I'm confident enough to use essential oils on my patients as a board-certified orthopedic surgeon, and just for the record, I need to maintain my board certification, and using particular modalities that would put my board certification at risk is a big deal. I'm so comfortable using them in the clinic, but also, just as importantly, with my own family. And using essential oils both topically as well as orally, some of the blends that have been virtual lifesavers at home have been what I would call the tummy tamer effects, or some of the soothing, cooling, warming effects when my family members are really struggling and really need some of the nice, lovely, soothing effects of essential oils. I can do that and be their hero dad, and it's wonderful. And of course, they come into my office and see me using it with my patients, so they kind of feel like Dad's being doctor at home as well. It's lovely. But even most importantly, when it comes to the sourcing of essential oils that doTERRA utilizes, I can use those on my own family, my loved ones, my wife, my children, with confidence, knowing the purity of those essential oils are not going to compromise the safety that is so important with using them both at home and in the office.